We're going to start talking about the reproductive system. We're going to begin with the male reproductive system and then continue on through others into the female and then oogenesis and spermiogenesis as well. So the reproductive system itself, we've got essentially two sets of gonads which produce all of the gametes that we're going to have. So the gonads themselves, testes in males, ovaries in females, those produce either the egg or the sperm, depending upon which one we're talking about. For the organs themselves, they're quite similar in terms of what we have there besides the gonads. We have a series of ducting systems that allow for us to move either the egg or the sperm to where they need to be. Along with that, the production of hormones, the production of glandular secretions to help in this process as well. And then the hormones are going to be those that are specifically for either the production of the gametes or for the maintenance, in a sense, of the reproductive system itself as well. And then all of the extra reproductive system processes that go along with it. So the hormones themselves, for the most part, up until puberty, they're going to be relatively low as far as their levels go. Because we don't need to have them for reproduction quite yet. But once those hormone levels do kind of increase at puberty, this is going to help with the final development of the reproductive organs, get them matured for reproduction itself. And then throughout the reproductive years, they're then going to help with sex drive, reproductive health in terms of the organs themselves that are there, and with cycling, especially in that of the female. So the male reproductive systems we're going to start with this one here is has a little bit more going on in terms of glands than that of the female reproductive system, but a little bit less going on in terms of kind of once things get going, the male reproductive system is kind of on autopilot in a sense. So the gonads themselves, we have the testes. Those testes produce the sperm that is going to be delivered to the female. That sperm is created within the testes themselves, and then they move down to the epididymis for storage. And so they're going to stay there until ejaculation occurs. The gonads also are the place where the production of hormones is going to occur, and so this is where testosterone is being produced as well. Once the sperm leaves the testes, it's going to move into the epididymis, stores there until ejaculation, and then it's going to go from the testes, which we're going to talk about in a little bit, are outside of the pelvis, so they've got to get back into the pelvis, and that's going to happen through the ductus deferens. It's going to go through the ejaculatory duct where it's going to meet up with the secretions from the seminal vesicles, and then that's going to enter into the urethra along its way. There are three major glands that we talk about in terms of the males, and so we have the seminal vesicles, which I just mentioned, we have the prostate gland, and then we have the bulbourethral glands. And so all three of those are going to add to the seminal fluid that the sperm cells themselves are actually traveling in terms of the ejaculate. So here we have kind of the overview of the male reproductive system. In terms of the organs themselves, we can see how the testes are outside of the pelvis. We'll talk about how they get there in just a little bit, because they did begin their origins up here inside the pelvis as well, just like the male ovaries do as well. That's there. The glands, we have the bulbourethral gland, we have the prostate gland, and then the seminal vesicles. The prostate gland is a singular gland. The bulbourethral glands and the seminal vesicles are paired glands, so there are two of them that lie within the organs themselves. The bulbourethral gland kind of just looks like one big one that is there. And then we have this big long ductus deferens or vas deferens that gets us from the testes, and the epididymis here travels up through the vas deferens, back into the pelvis, and around to the ejaculatory duct, which is where the seminal vesicles and the vas deferens kind of meet together as they go through the prostate. That's there. Once into the prostate, we'll see that see if yellow shows up here. We have long urethra in the male, and so 3 different portions to that urethra, and it's going to be a conduit for both seminal fluid as well as that of urine. So in order to keep the testes outside of the body, the male develops the scrotum. So the scrotum itself is just skin that encapsulates the testes themselves and the epididymis and part of the vas deferens there as well. That is inside there. The skin has several different, or the scrotum itself has several different layers to it. Some of those layers came down from the abdominal pelvic cavity when the testes descended from the pelvis. That are there. And so we have some fascia that's there. We have part of the parietal peritoneum that surrounded the abdominal cavity that's there, surrounding them. We've got a couple of different muscles that are going to change the position and the essentially warmth of the testes themselves as well, that are there. Each testes itself inside the scrotum is separated by a septum. And so they're kind of separated between the two. The two testes can't, for the most part, under normal conditions, be on the same side at all. And the reason for keeping the testes out in the scrotum is the temperature. And so the testes have a lower temperature than core body temperature. And this is going to be a necessity for maintaining normal sperm production. And so the cells themselves, if they get increased in temperature, they will decrease in their overall production that is there. The scrotum itself, as we'll start to see with many different structures, the scrotum has a similar structure as that in the female. And so we talked about what we call homologs. And so the female homolog to the scrotum is the labia majora. And so essentially, developmentally, the two tissues themselves, either the labia majora or the scrotum, developed from the same tissues. It's just that if in a male it becomes the scrotum, in the female it becomes the labia majora. That's there. I mentioned that there were 2 sets of muscles within the testes as well. We have the dartos muscle and we have the cremaster muscle. The dartos muscle is basically just deep to the skin of the scrotum itself. And so when this contracts, it's going to actually change the surface of the scrotum and kind of wrinkle the skin that's there. And so basically it's going to make it so that it's a smaller overall size than what it was when the dartos muscle is relaxed. The cremaster muscle comes down with what we're going to see is the spermatic cord that we have, and it runs along with the vas deferens and blood vessels and nerves that supply the testes themselves, and this is going to be able to bring the overall scrotal tissue either closer to the core body, so elevate the testes, or allow it to relax, and then they're going to move away from the body. So depending on the temperature of the scrotum, essentially these 2 muscles allow us to regulate that temperature throughout the day. That's there. So here we have just deep to the skin. Here you have your dartos muscle, and so that is running along the actual skin of the scrotum. And then this muscular band that's coming down, excuse me, is the cremaster muscle. And so when the cremaster muscle contracts, it's going to elevate the testes up. When the dartos muscle contracts, it's going to essentially wrinkle the skin that's there. So it's going to make it all tighter in and around the testes, so thereby reducing any kind of heat loss as it brings it closer to the body itself. And then here you can see part of the septum, and so this is going to keep the 2 separated from one another. The fact that there is a septum there can, when you get into things like pathophysiology, we can start to talk about things where things go wrong, in that something can occur on this side of the scrotum and it doesn't necessarily cross over to the other side. The testes themselves started out in the pelvis. So when they come down from the pelvis, they're going to, in a sense, kind of drag with it what's called the tunica vaginalis. And so that tunica vaginalis used to be the peritoneum the parietal peritoneum that was on the abdominal wall. And so that kind of came with it. Surrounding the actual testy itself, and part of the testy itself, is the tunica albuginea. And so we're going to see that the ovaries have a similar tunica albuginea, but they don't have a tunica vaginalis because they stay inside the pelvis. So they never have a chance, in a sense, to drag that tissue anywhere within them. They're just going to have a covering of the peritoneum around them, just like any other organ that is there. So the tunica albuginea is like the visceral peritoneum that would cover all of the organs. When we look inside the testes, we're going to see that the testes themselves are divided up into little septum. And so they have these little kind of packages that are inside each one, and they divide them up into smaller and smaller and smaller areas that are there. Within those, we have the seminiferous tubules. And inside those seminiferous tubules, essentially we've got a tube, if we look at it in terms of a cross-cut that's there. And along those tubes, essentially at the very ends of them, we have the developing cells. And so these cells are surrounding there in terms of the sperm cells, and they're going to end up into, once they're done developing, into the seminiferous tubules. Those seminiferous tubules are then going to travel along those septa, and they're going to move towards the tubulus rectus. And so essentially we're taking kind of lots of tubes in terms of the seminiferous tubules, and then they're becoming the tubulus rectus. And then the tubulus rectus, so let's draw another one in here. That one comes in, and we've got another tubulus rectus. Those tubulus rectus then become the rete testes, and then there's a whole bunch of them, and it's going to continue on, and they all, in a sense, kind of drain towards the same area. And then that rete testes eventually then gets us to the epididymis. That's there. So from the rete testes, the sperm then are essentially out of the testes and moving into efferent ductules, which then go into the epididymis itself. And so the ductules are essentially that conversion between the testes and the epididymis as they're moving into there. So again, kind of around that seminiferous tubule, said we have cells that are there, and those are developing should draw it in a different color here. Those are developing the sperm cells. And then we have an additional set of cells that are interstitial cells. These interstitial cells are what are producing the testosterone. So they're producing the androgens for the males themselves. The testes need blood supply. So they're producing millions and millions and millions of cells daily, potentially, depending upon essentially kind of the fullness of the epididymis itself that is there. So they need a good blood supply that comes down there. When we talked about blood vessels before, we talked about the gonadal arteries. The gonadal arteries now, in a sense, are just kind of the generic name for males and females. Now we can start to talk about them as being the testicular arteries themselves. And so those are going to come off of the abdominal aorta, just like the gonadal arteries did. And those then come down into the testes. And as they're doing so, they're coming down the spermatic cord, and they kind of supply the testes themselves. And going outward, we have a series of blood vessels in terms of the veins that create a big plexus. And so we've got this pampiniform plexus. And that pampiniform plexus is what drains the testes. So that's taking away all of the waste products from sperm production. It's also taking away things like androgens away from the testes as well and back into the blood supply. That's there. Series of lymphatics, nerve supply, all of that is coming down along the spermatic cord itself. So here we can see the spermatic cord. So when you're looking at it in terms of things like the anatomy, the spermatic cord is the entire structure, including all of the arteries, veins, nerves, and the ductus deferens that's there. If it was just pointing to, in terms of things like lab, if it's just pointing to the ductus deferens, then it's just the ductus deferens. If it's pointing to the entire thing, then it's the spermatic cord itself. And on this one, we get a good look as well in terms of the individual septum. So we have one full lobule here with the septums in between, separating each one. That's there. We then have our seminiferous tubules, goes back and forth and back and forth and back and forth. That then gets us into the tubulus rectus, right in there. And then the tubulus rectus comes into our rete testes. Those rete testes then into efferent ductules, and now we're into the epididymis. Sperm then gets stored there. It essentially gets matured and it stays inside there until ejaculation, and then ejaculation is going to cause smooth muscle contractions along that epididymis and ductus deferens to expel the sperm along the ductus deferens. The, in a sense, kind of unique structure between males and females is the penis. And this structure is a combination of, in a sense, uses, in a sense. It is the copulatory organ, so it is required for reproduction, that for the male, but it's also designed for getting rid of urine from the body. So it has a dual role there in terms of what it's utilized for the male. That's there. So the penile tissue itself extends all the way from essentially the glands of the penis all the way back along and essentially all the way back to almost the bladder. And so between the penile tissue and the bladder, we have the prostate that is there. And so the root of the penis itself is far inside, essentially right at the bladder there, and then the free shaft goes all the way out to the glans penis on its way out. The glans penis is surrounded by a covering called the prepuce, commonly referred to as the foreskin, that is there, and this is going to essentially protect the glans penis itself, and this is what is removed during circumcision. And so normally this kind of rolls over the glans itself, and protects the end of the glans itself there, but it is prone to potential things like infection, overproduction of glandular secretions, which leads to the production of what we call smegma. Inside the penile tissue itself, there are 3 cylinders. These 3 cylinders themselves are what are going to be filled with fluid during erection. And so the erectile tissue itself is a series of blood vessels that dilate and allow for blood to come in. And then on essentially the outgoing series of blood vessels for the penile tissue, these ones are restricted during the erection of the penile tissue itself that's there within that. And so in and along it, because it does have the urethra running through the erectile tissues themselves, we've got smooth muscle. That smooth muscle is going to help to propel the ejaculate as it's ejaculated from the body itself as well. So during erection itself, we've got essentially a series of these 3 tubes that are inside the penile tissue itself. We've got corpus spongiosum, corpora cavernosa, and then within that, the spongiosum is the one that is going to have the urethra. The corpora cavernosa, there are 2. And so there are 2 structures that are there, making up the 3 in total that is there. And so blood goes in, it's restricted in terms of its exit, so that enlarges the chambers inside the corpora cavernosa, which are the main erectile tissues themselves. We don't really want the corpus spongiosum to become overly erect in a sense, because then it would essentially clamp down on the urethra. So that needs to remain kind of open there as well. The cura is the very proximal end. So this is where it goes all the way down towards the bladder, kind of underneath the pubic arch there. but it is embedded into the pubic arch, and there is a set of muscles called the issue cavernosa muscle, and this muscle is going to contract again during ejaculation. And so this is going to help to propel the sperm through the urethra and out of the penis. So again, here we have, in terms of a cross section, you can see the two chambers of the corpora cavernosa that are there. The corpus spongiosum does have some erectile tissue in it, but not as great as that of the cavernosa. And then that goes all the way back to the very back of the urogenital diaphragm. And essentially on the other side of that urogenital diaphragm, we have the bladder. And so the prostate kind of sits in between the two. And of course, this is not quite in anatomical position either, because the all three of them don't lie kind of right in a straight line. It's just done for kind of ease of viewing. The epididymis is the place where we store sperm. And so after the sperm has been formed in the testes, the sperm cells themselves are going to go down into the epididymis, and they're going to stay there. The sperm that is there are non-motile, so they are not moving around or anything while they're there. They have to be ejaculated in order for that to occur, and so the mixture of the fluids themselves are going to help to activate the sperm cells upon ejaculation. That is there. The sperm cells come down from the seminiferous tubules and through all of the ducts to make their way to the epididymis. As they do so, there is testicular fluid that essentially they're floating in to get down there. That needs to get reabsorbed. And then from that point on, all of the epididymis' job is essentially to keep them alive. Give nutrients to the sperm cells, keep them alive until ejaculation. And then they can be released from that point on. The vas deferens or the ductus deferens is essentially just a pathway. So it's just a duct to get the sperm from the epididymis all the way to the urethra itself. So it goes from the epididymis up through the spermatic cord, through the inguinal canal. So going essentially punching through the abdominal wall and back into the pelvic cavity once it gets inside there. It's going to go around the back of the bladder, and at the back of the bladder, it's going to join the seminal vesicle. And so from each side, again, remember we've got two testes, two vas deferens. Both of those are making their way back towards the back of the bladder, where we have the seminal vesicles, and where the ductus deferens joins the seminal vesicle, we call that the ejaculatory duct. So basically one, and then the ejaculatory duct. So the vas deferens, the seminal vesicle, and then the ejaculatory duct. So they're all kind of joining together there and creating one at that point. That gets it into the urethra. It's entering into the prostatic urethra, then through the membranous urethra, then through the spongy urethra, and on its way out of the glands at that point along the way. At times, some males may choose to get a vasectomy. And so essentially this is as the kind of my crude drawing here, there's the testes and the epididymis and then the vas deferens. This can be done essentially outside of the pelvis into the spermatic cord, and they're either going to cut or potentially ligate, or nowadays there's even a fairly effective clip that can be done. And that clip, either way, essentially we're stopping the flow of sperm out of the vas deferens. Almost 100% effective almost all the time, but truly nothing is truly 100% effective. But almost all the time, once they've been kind of cleared that there are no sperm cells getting past there anymore, pretty much there's no chance of a male getting a female pregnant at that point. So the urethra in the male is different from that in the female, in that we have a prostatic urethra, a membranous urethra, and a spongy urethra. All three of those different portions lie in kind of different spots within the line of the urethra itself and along the penile tissue. So the prostatic urethra runs through the prostate. The membranous urethra is the shortest portion. It just simply runs through the urogenital diaphragm. And then the spongy portion is the longest. This runs all the way through all of the corpus spongiosum and then on the way out. And so again, it's going to carry either urine or seminal fluid, but it can't do both, as during ejaculation, urine is inhibited from being released from the bladder. In order to create this seminal fluid, we need the glands. And so we have our seminal vesicles, we have the prostate gland, and we have the bulbourethral gland for the three different glands themselves. The seminal vesicles produce the majority of the seminal fluid, so upwards of 60% of the total volume. This fluid here is going to do a few different things, and so kind of we'll see a similar process in that from the prostate gland as well. It's alkaline, so this is going to help with reducing the amount of acid that's potentially in the vaginal canal. So it's going to help to raise the pH. It's going to provide fructose for the sperm cells to have for energy. That's there. It's going to have coagulating enzymes, so vesiculase. This is going to help to essentially keep the seminal fluid inside the female. And then prostaglandins are going to help with getting the sperm cells all the way into the female and up to where it can actually find that egg in the female itself. Next up, we have the bulbourethral glands. These are the smallest of the glands. These ones are actually active more so prior to ejaculation, in that they're in the urogenital diaphragm. They release their secretions out into the urethra, and they're basically kind of there to cleanse the urethra. And so they're going to help to get rid of any kind of amounts of urine that may still be there, neutralize any kind of acids that are still in there from the urine, clear out any kind of bacteria potentially that are there, and so on. So the seminal fluid itself is a combination of that prostatic urethra, or the prostate, the seminal vesicles, and the bulbourethral glands themselves. When it's all said and done, we've got anywhere between 2 and 5 milliliters or so of fluid, which is there and has all of the sperm cells that are in there. So millions of sperm cells ready to go and find an egg along their way. It's going to help to keep them alive, gives them nutrients, deactivates things like acids, deactivates cilia in the female, reverses that ciliatic movement, reverses peristalsis in the uterus. So rather than the uterus trying to push things out, it's actually going to kind of pull things back in to help the sperm moves into the female further as well. So all designed to basically enhance the ability of the sperm to get to the egg itself, and that's the final goal there. That's there. And it also activates the sperm as well. So this is what's going to now allow the sperm cells to become motile, and that's going to help with that motility itself. We had talked way back when we did the endocrine system about relaxin and said we'd come back to it during reproduction, and here it is. So this is going to help in the male with sperm motility. So it increases their motility, allows them to start to move a little bit better. That's there. The female vaginal canal is open to essentially the outside world. There may be potential for bacteria there. So seminal plasmin is going to help with decreasing bacteria that may be present in the vaginal canal. Mentioned clotting factors before, so this is going to help to basically make the seminal fluid, rather from being a liquid, into something that is almost like gelatinous in a sense. That's there, not quite a full gel, but along the way there. And then when we look at the total amount, said before, 2 to 5 milliliters total of the ejaculate, kind of here or there. It all depends upon essentially when the last ejaculation was, things like that. And then the numbers of sperm cells can even be much higher than that 130 million mark, upwards of even 500 million. Again, depends upon when the last ejaculation was. In the testes, we said we had interstitial cells, and now we also have sustentacular cells. And so sustentacular cells are around, again, those seminiferous tubules themselves that are there, creating kind of this tight junction between that of the sperm ducts, essentially, and that of the blood supply. That's there. So the first layer there, the basal layer, is where we have growing sperm cells, so spermatogonia, primary spermatocytes that are there. And those are going to be moving on into the seminiferous tubule. And then we've got the abluminal cells. These are the cells that are actually dividing. So these are the initial cells to divide off and push down into the basal compartment as well. The junctions between the cells are tight junctions. So remember back to ANP1, this is what holds the cells tightly packed together, creating here a blood-testes barrier. We talked about a blood-brain barrier before. This is now a blood-testes barrier. This makes it so that the immune system of the male never sees the sperm cells. And so when it comes to sperm, they've never been made until puberty. So they've never had any kind of exposure to the immune system of the male itself. And since that's the case, if an immune cell of the male were to find a sperm cell, it would destroy it. It would see it as being non-self. And so we don't want to have them essentially destroyed before they have a chance to get to where they're supposed to go. So spermatocytes are developed here. We bring the nutrients to them. They can divide. They can grow. The cells themselves, essentially, and we'll talk about this later on as well, the cells essentially kind of start out as kind of like a cuboidal cell, and then the cells themselves are going to then start to elongate. Sorry for my crude drawing, until they're finally into a full-blown spermatocyte there. Should add a little bit of cytoplasm still, and then the fully formed sperm cell right there. And so this is going to allow for them to dispose of their excess cytoplasm. That's what this portion here was. So during that maturation process itself, it's going to lose that. Essentially, it's going to lose all other organelles, and so that it basically just has nuclear material and a motor. Mitochondria are kept, motor proteins are kept, and that's what is going to help it to move along in terms of its motility that it has. In order for the male to deliver sperm to the female, two things need to happen, essentially erection and then ejaculation. So erection, in terms of the male sexual response, comes from the potential of sight, sound, touch, things that are stimulating the central nervous system there, and that allows for the nerves to change the blood flow into the penile tissue. This is a parasympathetic response. So this is parasympathetics to start with that are there. Parasympathetics rest and digest, which means that we can also produce urine. And so urination could potentially occur at that point. If there's something wrong with those splanchnic nerves, if there's something wrong with the testicular nerves, the penile nerves, all of that can potentially lead to impotence for the male. Once the male has now an erection and it has been sufficiently stimulated, then ejaculation can occur. This is a sympathetic response. And so this is going to cause the ducts to contract. This is going to cause the accessory glands to contract and expel their contents into the ducts themselves as well. This is also going to cause the bladder sphincters to constrict. So this is going to stop any kind of urine propulsion at that point that's there. We're going to have bulbospongiosis muscles contract, issue cavernosus muscles contract, and that's all going to propel the seminal fluid all through the urethra at that point. But again, we have to, in a sense, kind of switch from a parasympathetic state to a sympathetic state, which means that for the male, there's a refractory period. And so in the male, there's this refractory period where we've got to essentially go from the sympathetic state back into the parasympathetic state for erection, and then, in a sense, ejaculation can then occur once again. That's there. The male secondary characteristics begin at puberty. This is going to occur anywhere between the ages of 9 and 13-ish for males. It's a little bit later than that of females, but somewhere in there. Typically, oftentimes, somewhere around 12 to 13 for males. Females are a little bit earlier than there, but it could go all the way outwards up to age 15 at times. Growth of coarse hair, so pubic, axillary, facial hair, arm and leg hair turns into terminal hair in males rather than vellus hair. That's there. Causes cartilage to grow, so things like deepening of the voice occurs as well. Testosterone also influences both bone and skeletal muscle. So bones are going to grow. Skeletal muscle is going to grow and increase in their numbers, or the size of the muscles themselves, but not the numbers. So we're going to get hypertrophy rather than hyperplasia at that point on there. And then testosterone is going to kind of level off. So in a sense, testosterone levels as we measure them, puberty hits, and in puberty, those levels could fluctuate some on there. And then adulthood is just basically going to stay the same. That's there, unless there's some outside forces that are kind of changing the levels of testosterone in the male. Testosterone is found in both males and females. Females in a lesser amount than that of males, but it is there, and it's an important aspect of libido. Next time around, we'll talk about the female reproductive system and start to go through that.